The Middle Ages, or medieval period in England, is often thought of a time of pestilence, poor quality of life, and a profound misunderstanding of the way disease is spread, and many other aspects of the way the world works. While this is accurate to a degree, this was also a time where methods of treatment and theories on the fundamental makeup of the human body were constantly being developed. One of the first and most prominent of these theories was developed by a man who became known as the father of medicine, Hippocrates. Hippocrates' theory was that the human body was made up of 4 humors: yellow bile, phlegm, black bile, and blood, which soon after publishing would become the most widely accepted theory in Europe for years. Out of this theory came some of the most common treatments for a wide variety of illnesses, including bloodletting and purging, which were practiced in order to rebalance a person's humors, in turn curing them. Correlations were also made between the humors and the behavioral attributes of a person. An excess of black bile was understood to be the cause of depression, and inversely, being in a depressed state of mind would cause the liver to produce blood contaminated with black bile. Although this frame of thought would not fully fade until much later on, attention began to shift in part away from treatment based on the 4 humors, or religious and ritualistic treatment, towards herbal and plant-based remedies developed from the studies of a Greek man, Dioscorides, which depicted over 600 plants and their medicinal properties. He also performed many dissections on animals and came to the conclusion that every artery transported exclusively blood as opposed to air, which was also a commonly held belief at the time. Despite being born centuries before the Middle Ages, he is also credited for having his work contribute to the rise of the very first official medical institutions. By the 12th century, there were medical schools throughout Europe, the most famous of which was the school of Salerno in southern Italy. Advancement in the field of treatment was and is incredibly important, but the understanding of what causes disease and how to prevent it from happening in the first place is perhaps even more crucial to improving the quality of life in a society. In reality, some of the largest contributing factors to why there is so much sickness in English towns is the complete lack of hygiene, close living conditions, and improperly preserved food. A less talked about source of vulnerability of these groups of people is the constant malnutrition of the populace. However, very little is known about the anatomy of the body due to the dissection of the human body being expressly forbidden by the church, except on executed criminals where it was considered to be part of the punishment. Instead, physicians followed ancient medical texts written by classical thinkers whose theories were based upon the dissections of animals, making them incorrect more often than not. Diagnosis was based purely upon observation of physical symptoms, especially the patient's urine, and treatment generally followed the theory of the 4 humors for a considerable amount of time. The misconception of how to approach preventing the spread of disease was a major contributing factor to the pandemic that crippled an entire continent, the Black Plague. This misconception being that illness was spread through bad smells. During the plague, a quote from King Edward III sums this up by depicting the streets of London by giving an order to cause the human feces and other filth lying in the streets and lanes in the city to be removed with all speed to places far distant, so that no greater cause of mortality may arise from such smells. This can also be seen in the iconic attire of plague doctors. Fit with a leather overcoat and a bird-like mask, it was believed to protect the wearer from the disease. The beak of the mask would be filled with herbs and flowers in order to counteract the smells that these doctors would encounter. This may have helped protect them from receiving and spreading some airborne pathogens in the same way that modern medical masks do, but the Black Death was not airborne and was instead spread predominantly through bites from infected fleas, which the cloaks offered little to no protection against. Another aspect about the misunderstanding of the nature of disease in medicine has to do with the social outlook that the majority of people adopted at this time. One of the main reasons that was thought to be the cause of sickness was that it was purely self-imposed and was a punishment from God for sinful behavior. This can best be observed in the case of leprosy. Leprosy was one of, if not the most feared disease by the English population in its time of prevalence, mostly due to the fact that it was perceived to be an incurable, mutilating, and contagious disease, when in reality it was little of all 3 things. This caused the formation of small communities of people with leprosy, in which the lepers became complete social outcasts from society. Effective treatment of leprosy went unaddressed in England for long periods of time as a result of the unwillingness to accept these people as members of society, as well as constant misdiagnosis of the disease. As more and more medical schools began to appear in England and the rest of Europe, this social outlook began to wholly disappear. Treatment and diagnosis improved exponentially, and within the span of several centuries, we have been able to make the transition between drilling holes in a patient's skull to release evil spirits, to learning how to create complex and precise machines that are able to perform operations that were of course entirely incomprehensible in medieval England.